Welcome. It's good to be with you again. Today, I'm going to turn the video over to Dr. Lynne Ogawa from our Department of Public Health to share some more information with you about the changing face of the coronavirus as we learn more along the way. Dr. Ogawa will focus on three topics. First, the new symptoms that have been identified by the Centers for Disease Control. Second, expanded testing in Minnesota and what that means for Ramsey County and our service delivery operations. And third, continued tips to help you prevent the spread of COVID-19 here personally and with those around you. I hope you find this video useful, and I thank Dr. Ogawa for her time and expertise. Have a wonderful day.
I just want to thank Ryan O'Connor for inviting me to be part of this video series again. And as he mentioned, I'm going to be talking about a few things. My name's Lynne Ogawa. I am the Medical Director for St. Paul Ramsey County Public Health. Ryan mentioned that the CDC has recently updated their information around symptoms reported with COVID infections. And so as we see more infections with COVID and we talk to the individuals who have been infected, we learn more about the symptoms. And so that list of symptoms is growing somewhat. Primarily still, we see cough, shortness of breath, and fever greater than 100.4 as the most primary symptoms that we worry about. And they still remain the most common that we see. However, the CDC has now added and expanded the list to include chills, specifically shaking chills, muscle pains or myalgias, and usually that means sort of more whole body muscle aches. New or unusual or different headache, sore throat, and then one of the newest ones is a loss of smell or taste. And so all of these symptoms are ones that would, if you notice any of them, should prompt you to talk to a healthcare provider and think about being evaluated and or tested. Symptoms usually appear between 2 and 14 days after a person has been exposed and infected with the virus. The next topic that I was going to talk about was the expanded testing and that eventually what that impact will have on Ramsey County and our services. So right now, there are two different ways that individuals can be tested. One is through the MDH state lab. They run about 10% of the tests each day, about 300 tests per day. The other way is through a regular healthcare provider, your own private health system or your own private provider. And those tests account now for 90% of the tests being run in Minnesota, which is about 3,000 per day. We all heard Governor Walz recommend and talk about the importance of even expanding that number higher to as many as 20,000 tests per day. And so the commercial and health systems like University of Minnesota, like Mayo, are all expanding their capacity to handle more and more samples. We're seeing the establishment of more drive-through testing sites. We're seeing health systems expanding who can be tested, so not just healthcare workers who are symptomatic, not just people in congregate living situations like nursing homes, but we're seeing people who are at high risk for complications associated with the disease and the infection, which is we want to know those individuals so that we can be prepared to help take care of them. It's important that we see enough people in the community being able to be out of isolation and protected. And so we need to be seeing those numbers go up. Our biggest concern is the individuals who are at risk for complications associated with the infection. Those individuals with chronic underlying conditions, racial and ethnic minorities, because when they get infected, they are at much higher risk to need to go to the hospital, to be in the intensive care units. And if too many of them get infected at once, it overwhelms our system. And so we highly recommend that people who are at risk for complications of the disease, those with chronic medical conditions, stay safer and isolated from others longer so that they don't all get infected at the same time and overwhelm the healthcare system. It seems like there's two messages. On one hand, people are supposed to not be worried about getting this infection, that for most people, about 80% is a mild infection. But then we're also telling people to stay home and away from other people, and it's really about protecting those most vulnerable. So the positives, as long as we control that spread, the higher number of positives, as long as we don't begin to see hospitalizations rising or intensive care units being overwhelmed, that's the kind of controlled spread that we want to see.
With each of those positive tests that we see, each of those is an individual. And in Ramsey County, last week we were seeing on average 30 people per day who were being reported to us as positive for COVID infection. Already with the expanded testing, we're seeing 75, and we expect that number to grow. Each one of those numbers, though, represents a member of our community. Doesn't just represent, is a member of our community, is an individual who is sick with an infection, worried about their own health, worried about the health of their family, worried about the health of their community, and they need more support from the county than ever before. We're going to be transitioning as well from the state talking with those individuals and learning about their infection to the county, our St. Paul Ramsey County Public Health, helping to support those individuals and be interviewing them and talking with them. And the reason we're transitioning from the state to the local public health is because we in the local public health, we here at Ramsey County have more community connections. We're closer to the individuals. They trust us, and we want to be able to meet their needs and be available to them for anything that they would need, and be here for their support.
Lastly for today, Ryan mentioned that I'd also be talking about doing our individual best to help prevent the spread of coronavirus as well. This goes back to the recommendations that have been with us from the beginning, but I want to focus a little bit on those that help prevent spread. One of the most important things is that when you're sick, staying home, staying away from other individuals. And so the best way that we can keep from spreading this infection is, if we are sick, not being around other people. Also, wiping down surfaces with appropriate wipes and sanitizing agents is also important, because we want to make sure that any residual virus on surfaces are not picked up by other people. Along with Governor Walz, the recommendation of wearing face masks in public helps limit any spread of the virus to others in those situations where social distancing can't be followed. And so it's important to think about that. To protect yourself, you still want to make sure that you are washing your hands regularly to avoid any virus on your hands coming in contact with your face. And so again, keeping from touching your face is important as well. What's difficult during this time is that we all are wanting to keep ourselves safe, our families safe, our community safe, and it's important to make sure that you're doing what you can as an individual to help prevent the spread and to protect yourself. In addition to that, as a county, we're recognizing that we're going to be needing to help others be able to take care of themselves, take care of their families, and for us as a county to take care of our county.
And so all of the work that we're doing is important, and we need to make sure that we're taking care of ourselves as well.